So this week, it is an absolute privilege to be joined by consultant perinatal psychiatrist, Dr. Rebecca Moore. Rebecca is a mum of two and the founder of Make Birth Better, a national campaign working to raise awareness of birth trauma. Rebecca is an expert in the assessment and treatment of birth trauma with over 20 years of experience working with women and their psychological needs. Rebecca utilises a holistic approach in her work, and amongst all of the amazing things that she is doing to help support women, she is also training currently to be a yoga teacher. Rebecca's role is expansive and incorporates working with and supporting women who have new onset or pre-existing emotional issues through pregnancy and up to a year after birth, both in the NHS and privately. This includes infertility, pregnancy loss, anxiety, depression, OCD, and trauma. She's also currently a leading figure in driving the recognition and awareness around birth trauma, hosting conferences and creating networks, to name just a few ways that Rebecca has been dedicated to spreading her knowledge and improving care and health outcomes for women. I'm therefore so grateful to have Rebecca and her wealth of experience and enthusiasm for this topic joining me today. So welcome, Rebecca, and thank you.
Oh, thank you. Wow, that doesn't sound like me. That's great.
It most definitely is you. It most definitely is. We've certainly got the expert on the subject, so I'm really grateful for your time, because I know you're a very busy lady and dedicated to lots of amazing projects.
No, you're very welcome. I'm always available to kind of talk about these issues because I'm just very passionate about them. So thank you for the opportunity.
It's brilliant. And like you say, we really need to raise awareness and kind of recognise what birth trauma is and what it isn't, I suppose, as well. Do you mind just kind of discussing a little bit more about that?
Yeah, of course. I mean, I think that's a really good point to start from, because I think depending on what you're reading and where you're looking, you can often see lots of different ways that trauma might be described. So, you can see birth trauma or perinatal trauma or a traumatic birth. And sometimes you see a postnatal PTSD. And I think, those terms are not always well defined depending on where you're looking for information. And that can be really confusing for people trying to navigate. I just want to know what's going on for me at this point. So I think when we talk about trauma, the key thing to think about that is related to your birth is that, it's completely subjective to you and what your story and what you experienced. And that might be in pregnancy, during your birth, postnatally, or all of those things. And it might be one thing, or it might be 10 things. So every single woman or partner indeed is going to have a different story around birth trauma. But really, when we're talking about trauma, we're thinking about an experience that you really feel stuck on and you can't quite move beyond, and that perhaps you're replaying or reliving in different ways all the time. Now, trauma is a spectrum. So, for a woman having a traumatic birth, they might have symptoms and feelings that last them for a week or a month or a year. And some of that group will go on to develop a clinical PTSD, post-traumatic stress disorder, but some won't. And so it's really, really important that women, are able to see somebody who can confidently say to them, look, this is what is going on for you. Because otherwise, I think for a lot of women, they're left with these really big, difficult feelings and don't really know how to seek help or what to do with that. So trauma is very common. It really is common for women around their maternity journey sometimes. So it's really about thinking about it as your story. And I think often there can be a difficulty with the word trauma even, because sometimes it can seem too big. And I think as women, we're really good at minimizing what we're feeling and just kind of putting our heads down and getting on with things, particularly as a new mum, because you sort of have to be able to do that to a certain degree. So, if you can't perhaps think of yourself in those terms, think about it as a really difficult experience that sort of feels like it's with you all the time, that you can't quite get beyond. It doesn't matter what you call it. you know. So if trauma doesn't feel the right thing for you, you don't have to use that term also.
Yeah, that's really important, because I think for women that perhaps birth trauma isn't a kind of name that they are familiar with, and perhaps a name that they're more familiar with is postnatal depression. But it's important, I suppose, that we recognize these are quite different things, aren't they?
Yeah, they're very different. So, you know, if you just have trauma, or just have trauma, I mean, you know, that's a huge thing to be having. You will have a different set of symptoms and feelings usually to if you have a depression. And often people don't know quite what's going on, but they know that they don't feel depressed. And then it's really frustrating when people sort of are saying to them, perhaps you're depressed, which often happens, unfortunately. So, you know, they have distinct you know, feelings and emotions and symptoms and signs associated with them that sometimes overlap, but are usually quite easy to distinguish. So it's really important that we get it right for women, because you don't want to send somebody off down a pathway of treatment that's not right for them. You can, of course, get depressed after having had a traumatic birth, but it's important to recognize the trauma in its own right as well, because that's a big part of the picture of, you know, what you need to heal from and process.
Yeah, definitely. And we kind of alluded to the fact that actually birth trauma is quite a common thing for women to be experiencing. But given the fact that we don't generally recognize it in the same way we might recognize things like PTSD or postnatal depression, kind of how common is it? And are we kind of underestimating, I guess, because we don't really know that we're recognizing it in all cases?
Yeah, so it's very common. All of the literature, and actually there's some really good studies now, um, probably underestimate. So an underestimation would be that 1 in 5 women, 20%, suffer from some kind of traumatic experience around birth. I think other studies, you look at them and it's 40%. I
Wow,
suspect
yeah.
it's probably somewhere in the middle. So, you know, for me, I suspect it's probably around 1 in 3, because I think there's a big group of women that probably never get picked up or never tell anybody how they're feeling. But, you know, this is a really big group of women that are walking away from their birth experience feeling that it was very, very difficult for them. So it is really, really common. And then certain women, you know, are more vulnerable to finding their birth traumatic. And then a proportion of the people that find birth traumatic will then go on to develop PTSD. So that's probably around 5 to 8%, again, depending on which studies you look at. But if you think about, you know, 1 in 5 to potentially 1 in 3 women giving birth on any day, walking away feeling traumatized in some way, that's really huge numbers of women. So that's why it's really, really important that we get better at thinking about this, asking the questions, and then knowing how to support women if they're saying, yes, actually, that's me.
Yeah, definitely. And like you say, that's huge numbers every single day. And isn't going anywhere, you know, it's only going to increase. And therefore trauma is going to mirror that. So it's something we need to work on. And there's so much work that needs to be done. I couldn't agree more. And I think when we think of the term trauma, we think of something maybe catastrophic or some major emergency or something really alarming and out of the ordinary, but that's not the case, is it? Because that's not necessarily happening in 1 to 3 or 1 to 5 women's birth. So what could women have that may kind of trigger a trauma or might feel traumatic to them?
Yeah, so I think that is a common thing, is that, you know, people just say, well, isn't that to do with war, or isn't that soldiers? And really, you know, trauma is defined as an event that feels to that person completely out of control, or feels where you feel utterly helpless or terrified or scared or frightened. So that doesn't, you know, need to be something like war. You know, trauma can happen after birth. It can happen after an unexpected medical illness. It could happen after a car accident, after a divorce, after a perinatal loss. You know, these are all traumas. And sorry, I've forgotten the other part of the question that you asked me.
No, not at all. No, it's fine.
It was about,
I just wonder whether sort of when we think
what
about,
traumatic.
so whether that's a big emergency or whether it's something kind of.
My brain just went completely fuzzy.
No,
then.
it's fine. It's fine.
So, yes, so it is, you know, it is back to that subjectivity of that, you know, if you put 10 women who would say, yes, I found something about my birth very, very difficult and distressing and traumatic, they would all identify very, very different things. But I suppose broadly you can think about it as being groups of thirds. So for a third of women, you know, there perhaps has been a medical emergency as part of that trauma. So something has happened, perhaps there's been a concern about baby, or they've been rushed to theatre unexpectedly, or they've had a bleed, or they've perhaps had a tear, a physical birth injury. And then for about a third of women, it's something based much more around baby. So it might be that, you know, baby has been unexpectedly unwell, excuse me, when they've been born, or they've had to go to intensive care, or, you know, perhaps there's been a prior loss. So, you know, that group, it's more focused around the baby. But actually, I would say, although, you know, in the literature, it's about a third, the group that I most often hear is about those interpersonal skills. So that is very much about how you are made to feel during your birth. And I think that's the bit that is probably growing. And I think we can go on and talk about why that might be the case. And I think that's also a real group of opportunity where we have an opportunity to change that and reduce that trauma. So that's typically women feeling alone, unheard, dismissed, that their pain requests are not heard, not met, belittled, that people make comments that are unkind, that there's a lack of compassion, that there's a lack of kindness, that they feel unsafe. And I think you only have to look at the sort of the recent Cumberland review to be able to see that, you know, women's stories are often not heard or dismissed. And actually those are, you know, the stories where women will be able to tell you sometimes 10 years down the line the exact comment that somebody made to them that forever loops in their head, and they will never forget the way it was said to them or how it was said to them. And they'll be able to tell you what that person was wearing, and, you know, how their face, can still see their face. So those interpersonal skills really, really matter. And of course, you can have a mixture of all three. So it might be that all, you know, there are different strands coming in. And I suppose the other things that kind of happen, you know, it can be if you have a very, very quick labour, you can imagine why you can feel out of control and helpless and shocked. So, you know, people delivering much more rapidly than expected, or conversely a very, very long labour where you're getting very tired, you feel your pain control's not being managed, and then perhaps it becomes very medicalised at the very end. So there are all kinds of different unique factors, but I think for me the interpersonal group is certainly a group that I hear all the time. It's very, very often about how women are being made to feel. And that is really upsetting, because so many of those things as professionals, we really ought to be getting right. And, you know, you would hope are part of just our day-to-day good practice. If you're no longer able to be kind to a woman during her birth, then we really have got some things to tackle.
Yeah, I couldn't agree more, Rebecca. I think that's really sad that I understand when there's the rapid birth or the emergencies that some of that trauma unpicking is really difficult to avoid. And actually that support afterwards is where we need to be really concentrating. But like you say, a lack of kindness or compassion is completely inexcusable in any kind of care setting, but particularly in that maternity care setting, because for these women it might be the only time, especially if it is a traumatic experience, that they come through our services, and having a baby should be the most monumentous and beautiful experience. So the idea that this amount of women are leaving our service feeling this way, it really fills me with a lot of sadness, but also a lot of motivation, with especially looking at the work that you're doing. We've got to change this and we've got to get it right, because we're doing women a huge injustice. We can make our care as safe and as technically brilliant as we can, but if we can't do that with kindness and compassion, then it kind of feels wasted, doesn't it?
Yeah. And sometimes I will talk to people where they've had this whole catalogue of things happen to them that you think, my goodness, and actually they walk away feeling okay. And the difference is always a person, a human being who has sat with them, held their hand, been calm, been kind, allowed them to ask questions, explained what's going on, acknowledged that they feel frightened, just been with them through that journey in a very human way. So these things really, really matter. And that's where I think, it's so important as midwives in particular, because I think often people underestimate that. They forget the value of that in their day-to-day journey, work, because it's busy, the pace is always busy. But these tiny gestures that in reality take seconds or minutes are massively powerful within trauma, particularly. So every single midwife can do so much, to really improve the outcomes for women here.
And like you say, it doesn't take a lot. It is that holding someone's hand and having that eye contact and just asking them what their questions are and explaining things and making sure, I guess, women feel heard, because especially in the kind of rushed day-to-day services, or if there is an emergency situation, that can be lost, and that feeling of loss of control and loss of empowerment can just have such kind of catastrophic effects for that woman going forward, can't it?
Yeah, really, really, really can. And has not just for the woman, but the whole ripple effect for the family, for the relationship, for the children, intergenerational trauma we know more about now, for future pregnancies, for potentially not having future pregnancies because your first experience has been so difficult. So these are not just events of one day, they are events over a lifetime and several lifetimes, so they really, really matter.
Yeah, definitely. And I always try and explain to some of the students and things that come through our service, because they worry so much, and rightly so, about getting certain skills down. And I say that people aren't going to remember whether their blood pressure was done on time, but they are going to remember whether that cuff was put on gently and they were chatted to and you were explaining why you did it, and it was done with that kindness that costs us nothing, but is just so important. And I like to think that no one goes into a caring profession with the intention of being anything other than kind, but I think it can get just, I guess, a little bit forgotten when you're focusing on other things, and we really need to remind ourselves about that.
Yeah, absolutely. And I think that's a whole second conversation, is that we need to look at why might it be that people working within maternity services are losing the ability to be kind and compassionate, because of course they're all kind and compassionate people. They nobody goes into that role or trains or works that hard with the intent to do harm. They're amazing practitioners. So I think the bigger issue is, why are people feeling or not able to do that consistently over time? And I think that's a really important part of the birth trauma picture, because actually what we need to do is not just care for women and their families, but also be caring for our teams. And I think, we all know that there are record amounts of burnout and stress